I'm Dave Mastovich of Mass Solutions. We work with Cucamonga Valley Medical Group to help them tell their story to patients, employees, families, and everyone in the Cucamonga Valley region. Today, I'm with Dr. Kyle Smart, the Chief Medical Officer at CVMG. He's done a lot of work on studying vaccines, and we want to give a breakdown in more detail about how the COVID-19 vaccine is similar to vaccines of the past and what we can expect as patients and the United States and the country wanting to be able to have this vaccine work. Dr. Smart, how are you today?
Hey, Dave, thanks for having me again.
One of the things you told me before we started recording was you were saying how back when you were researching things in 2015 for an article that you had to build that article based on things that had happened a while ago. What are you seeing now that maybe confirms that article or would help if you were writing that article today?
Yeah, so in my medical training and my medical career has taken place up until now in a time where we could have an argument about to vaccinate or not to vaccinate because we didn't need to. Vaccines have worked and they've quelled the respective pathogens, the bacteria and the viruses that they were developed to fight. And yeah, we had some scary flare-ups in the world, like Ebola or measles or some bad influenzas, but none that quite had the impact worldwide that some of the history lessons taught us about vaccines. So my goal in 2015 was to relate some testimonials almost, because that's what I have found impacts people's values and beliefs and behaviors is when they can really see somebody else's perspective and understand their story, then that helps them make an informed decision. And in this case about vaccines. And so again, in 2015 and up until now, we haven't been confronted by a worldwide pandemic that united us. However, that wasn't the case. And those stories that I wrote about in that article and then in subsequent blogs, they're forgotten. They're long forgotten. And I thought if I could just share about how scary smallpox was, that 30% of the people that got that would die, and that people raced to figure out a way to protect themselves and their families against that. I felt if I could share the story of the children of Nome, Alaska, who had a diphtheria outbreak, and they could get the antitoxin as far as about 600 miles away, and the rest of the way had to be taken by sled dogs and mushers over the sea ice. I mean, it was perilous, and the whole country followed this story. And several of the sledders, they got frostbite. Several of the dogs died, but they were able to get this antitoxin to this remote part of Alaska. And the whole country was transfixed by the story. One of the sled dogs' statue is still in Central Park, I think Balto. I felt if I could share that mechanical ventilation, the whole breathing tube and automatic ventilator that we take for granted today was built to save people from polio. Polio would cause the respiratory system to be paralyzed. People couldn't breathe. So they made mechanical ventilators, but they weren't small machines that could be wheeled around on a table. They were massive iron tubes that held the whole body, and only the head would stick out. And I felt if people could understand how serious and dangerous and deadly and traumatic these diseases were, and that vaccines offered a cure of prevention, that it would impact their beliefs and values and understanding about vaccines and help them make more of an informed decision.
That's really helpful and insightful and almost staggering to think about when we are looking at this pandemic, which has been tragic, but it's nowhere near any of those examples that you provided. When you look at the vaccine for COVID-19 and how it's starting out, what are your thoughts there as far as how we'll be able to distribute it, and what will that look like in comparison to some of those other tragic situations in our history?
To give some perspective, I know to a lot of people out there, COVID-19 still does not feel real, but tens of millions of people have been infected in our country and around the world. And in our country, we're around 300,000 deaths because of COVID-19. And that's very real. We are protected by a 330 million population. So there's a buffer there. But for the medical community, where the ICUs and hospitals are full, and we've had pockets of this since the inception of the pandemic back in March. Seattle has gone through a very challenging season. New York has gone through a very challenging season. California is currently at over capacity and really implementing some precautions. And so, again, when I wrote that article in 2015, I was drawing on past stories. And unfortunately, such a tragedy, we have one right now, and it can be drawn upon to show the importance and the benefit that a vaccine can offer.
Well, break down the basics, and I know a little bit, I'm sure everybody out there does too, but just walk through the basics of what a vaccine actually does and why there's 2 cycles of it, and why it takes so long to get that done, and how difficult the distribution is going to be. Give us a little bit more of a real life example, because we hear on the news and on the channels and the blogs and so forth, you hear kind of snippets and sound bites. Give us a little bit more about the real life aspect of vaccines.
So Dave, that's a great question. And there are currently 4 strategies that they are using to help implement a COVID-19 vaccine. So first is using an inactivated COVID-19 virus or a live attenuated virus to prime our immune system. And obviously people can understand what an inactivated COVID virus is, but an attenuated live virus just means that the virus is still alive, but can't really cause harm. Another strategy is to use a different virus to expose the host cell to the desired virus's genome. And I know that sounds crazy, but you're basically using like adenovirus or Norwalk virus or flu virus or measles virus to smuggle in COVID-19 genetic material into the human body and prime the immune system that way. Another strategy is to actually use the viral protein. So the protein everybody's excited about is the spike protein. The spike protein is on the cell membrane of the COVID-19 virus, and it helps the virus to attach to our respiratory cells. And if they can use that spike protein, they can expose us to that spike protein, we can develop antibodies to it. So one of the strategies is to just inject the protein directly. And then finally, the new technology is the mRNA virus vaccines, where they use pieces of the COVID-19 mRNA that code for the spike protein, and that's what's creating the immunity. And the mRNA virus strategy, the companies that are doing that, they are the first to cross the finish line. And so those are the first vaccines coming out from Pfizer, BioNTech, and Moderna.
Thanks for that summary of the 4 ways. Is there somewhere you'd suggest that any of us can go look to learn more about each of these 4 ways, so we might be helped with our decision on which vaccine and when we would get the vaccine?
Yeah, so let me say that, first of all, some of these strategies sound radical, but they are all actually being used currently in various vaccine and cancer treatments. So that's an interesting point in and of itself. Secondly, the New York Times COVID-19 vaccine tracker is a great resource people can look at and see which companies using which strategy and which phase they're in.
With step 4, strategy 4 is the one that's happening now. And you and Dr. Mawjood were on another video and explained how there were 2 times you'd have to get it, 2 parts to it. Talk about that. And you had said, we had to get ready for a Super Bowl, no Super Bowl parties probably with 50 people. It's going to take months to do this number 4 strategy. Talk about that. And then my follow-up to that would be, what about the other 3 strategies? When would they come into play?
So as we've discussed, these mRNA vaccines are 2-dose vaccines. So the first injection is that mRNA, a piece of mRNA that codes for that spike protein. And you get injected with that, it causes some of your cells to start creating that protein, so you develop antibodies to it. And that first one is just a little bit of a primer for our immune system. And so after a few weeks, you give a second dose of that. And by that time, you've already got some antibodies ready. But then when the protein's made again, those antibodies attack. And then a whole second wave of immune cells are educated on that protein so that you're even more ready. You get that booster and you're more ready for a natural infection.
What's the downside of it? What's the potential pain that I might be in after the first dose and the second dose?
People don't like needles. Okay. And so I have these big, strong men and women come in with tattoos everywhere, and they're afraid to get a shot. And clinicians everywhere just facepalm because they're like, you have tattoos everywhere and you don't want to get a shot. It's a paradox. But anyway, people are nervous about a shot. It's given right in the muscle, the deltoid muscle here. It can be given in the shoulder. I'm sure in kids it can be given on the upper leg, the quad area. And secondly, the real thing to watch out for in these mRNA is that second booster. That's the one where people can feel symptoms of being sick. So a lot of people feel flu when they get the flu shot, even though you cannot get the flu from the flu shot. But what the flu shot's doing is priming your immune system to the flu. And that's what gives you those symptoms of body aches and maybe a low-grade fever and just not feeling well, fatigue. And similar to the COVID-19 vaccine, you can get a similar response. There's another possible allergic reaction. A couple cases I've heard out of the UK where people had an allergic reaction, and they're trying to figure out where that came from as well. But that seems to be very minimal as a risk as well.
For the majority of people, 95% or higher probably, you're going to have almost no discomfort other than the fear of getting a shot, which I had blood work done today, ironically, and I turned my head. And so I fall into your category. And then the second one, you might get a little bit of feeling a little bit off for half a day or a day, something like that. So that means that the risk is minimal. Now let's talk about the success. How successful do you think it can be?
That's what's amazing about these technologies is they've shown to be 90+% effective in preventing COVID-19. That's unheard of in a vaccine.
Dr. Smart, what other concerns have patients been raising with you related to vaccines in general and the COVID-19 vaccine specifically?
Dave, that's a great question. So number one, as I've written about in prior blogs, sometimes vaccines are created using human cell lines. And again, those blogs get into the details of why and how that technology has been utilized. But there's some ethical concern about using human cell lines in the development of vaccines, as well as some safety concerns. And it is very clear that these mRNA vaccines are developed without using any human cell lines whatsoever. A second concern is the use of mercury as a preservative. Now, mercury is being phased out of vaccines as a preservative. Specifically, mercury can be found in a chemical called thermimazole. Specifically, mercury can be found in a chemical called thermimazole, and no mercury or thermimazole is used as a preservative in specifically the Pfizer vaccine, and I believe the Moderna as well. But we'll know more about the ingredients in the Moderna vaccine when it's approved by the FDA in the coming days.
Dr. Smart, as always, it's great to talk to you about getting just the straight truth and just hearing facts and stats and details that can help us as consumers. Throughout this video, you've seen some links that have been placed on the screen, but you can also go to the CVMG website. Anything else you'd like to add, Dr. Smart, to close out another one of these helpful informational videos?
It's a unique time in history of mankind. It's been a long time since the world and countries have rallied around a vaccine like this. It's been created in light speed. It's being given out now. There is light at the end of this pandemic tunnel that we have all been through in 2020. And again, it's all because of the tragedy of what we've been through. But you don't have to draw on stories that have been forgotten to time. We have currently lived one out in 2020, and we have a vaccine now that's here, and there's going to be more to come.
As always, we appreciate Dr. Maudry, Dr. Smart, when they do these informational videos for the folks of the CVMG region. Thanks again, Dr. Smart. More videos to come.